likely that you're going to introduce it into your own country to help your own people. Is this what this is all about? Yeah. So it's more on a learning curve, so we are all...
Yeah, it's important.
Well, as I understood it is about the health.
Yes.
But the health, there are different ways of approach.
Of approach, right. Okay. Yeah.
One is to treat the patients, the other is how their lifestyle, feeding, etc., physical activity, etc. Yeah.
As the lady said a while ago, I believe in prevention is better than cure. I think this is one of the biggest. And then what we are doing here, as she mentioned, it is prevention. And prevention is by eating healthy, exercise a lot. That way you can control the body. You look after it, it look after you. Yeah. And eating habit has to change. That's the most important thing. Okay? If you cannot change the eating habit of your people, then you'll be on a losing battle, because no matter what you try to do, if they're not helping themselves, and why not make it in such a way that they help themselves, then you just on a losing battle. Because the most important thing is healthy eating, plenty of exercise. That's what I think is the way forward.
And I think it's to make it interesting for the people, isn't it? Because in this program, there's lots of different activities. There's swimming, there's yoga, there's the gym with all the different activities, the sauna, which helps detoxing. So, you know, for everybody, running and walking, you know, and even walking exercises, walking groups. And so, you know, there's always something for everybody. You've got to really make a broad base, you know.
Do you do any physical activities
Yes,
yourself?
yes.
What do you prefer?
I do yoga and I go to the gym. And so I'm gradually building up my strength, you know, because I've had a few illnesses and quite serious illnesses.
And you?
I go to the gym.
Gym, huh?
Yeah. Swimming.
Swimming.
What I've gained is, because I've got children, so I think it's been good for me, because what I'm doing here, I'm taking it back, and my children learn from it as well, especially the label reading. Even though they're young, they read labels from the local supermarket. They come to the session with me as well. They even been to the gym with me, which is good.
And how many times do you do gym?
I do gym 3 times a week.
3 times a week.
Well, I do 3 times myself. I'm very active. I first started with the exercise on prescription, which I do that on Fridays. Wednesday I do the yoga, and Thursday I do the gym. So I remain very active and I get healthy. And from the time I joined the weight management program, when I remember I first weighed myself, I was weighing 74 kilos. Now I'm weighing 70 kilos. So I'm very proud. And there's a long way to go yet. And then you have to substitute, to sustain that, you have to keep active. You've got to keep...
It's a successful program.
Yeah, no, it is. It is. And it doesn't just help people with, I mean, yeah, no, I was 16 stone before I started. But I mean, the other thing is, like Jasmine said, it's passing it through the family, because at the moment we can only work with over 18s. We'd like this to change and we're going to start a mums and kids club after school, so there's very little childcare in the area. So if we can do them all exercising together, brilliant. So that's the sort of route that we'd like to go down. So passing it through the family is very important. And also with regards to mobility issues, like Henry said, exercise on prescription, you had a lot of leg pain. We have people on the programme who have not necessarily lost heaps and heaps of weight, but we have one chap who can now walk without a stick because he's doing yoga classes, exercise on prescription, and building up the muscles.
And do you have any medical assistance? Let's say medical consultant.
Yes,
Yeah.
there is
physiotherapy is something like that.
Yeah, we have the exercise on prescription run by a physiotherapist. Then also we have all the GPs here downstairs on hand. So if someone is referred to the programme and they have a lot of medical conditions, then we'll work very closely with their referring GP just to make sure that we don't ask anything of them that could put them at a health risk.
I came into the programme as a health champion, and this is somebody that goes out into the community and encourages people to join these programs. So we go to libraries, supermarkets, doctors' surgery, and we approach people in the community and we say, this is what's on offer. There are the classes, there are diet programs, and there are cessation of smoking programs, and we invite them all to come along. One of the key factors we tell them is it's free, because people run away if they think they've got to pay for it. And so this is a really good bonus point, that they can come along to these programs and know they're within the community. They're basically run by people that are from the community. And you can approach people because you know what it's like to live in the community, which is a really, really strong point. And people then will listen to you. And that's why I actually joined the program, so I could then go back and say, I've done this side, I've done the exercise, I've done the weight loss, and I've actually lost £12, £11. I've gone from 12 to 2 anyway, so I've dropped stress size, which is very pleasing for me. So I can actually say to them, as I'm part of this program now, what the rewards are, and what the benefits are, and what the problems you might have to overcome to come along to these classes, because a lot of mums can't come because they've got children, classes might interfere with them. So you can find all aspects and ways around it, and you can actually bring loads and loads of different parts of the community into the program.
I think that's an important part. The fact that there's different classes at different centres, so people can go to a centre close to them as well as coming into this centre. I think that's important. So, and also the exercise, they've got, you know, the day, they can go any time in the day. So, you know, if a mother's sort of working, you know, or she takes her children to school, she's got like an hour or so, she can actually go to the centre. And that's very important because there's no prescription, you've got to be at that place at a certain time, because that stops a lot of people doing things. And especially if they've got illnesses or whatever, so they go when they're feeling a bit better, you know, one day when they're feeling better, 1 hour when they're feeling better, they can actually go and try and improve their health, you know. So this aspect is very important, the freedom of, you know, being able to go at different times.
And we are quite lucky with Tower Hamlets because we do have a lot of things that are there. And then it's just being able to tap into them.
And finding out about them.
Yeah.
This is the thing that I wonder if this programme wasn't here, and if the exercise wasn't free. Firstly, how people would find out about it, and secondly, how people afford it. I mean, one of the gyms that we have access to, the monthly membership is something like £17. That doesn't sound a lot, but if you're on benefits, which a lot of people are, then you can't afford to go.
Because we do have a high proportion of unemployed. We do have a high proportion of people on a very low income within Tower Hamlets.
Yeah. And it's very densely populated.
And also, and the language barrier as well. I mean, you think of taking yourself to join a gym when you can't even, you can only say your name and your date of birth. It's, you know.
One of our programs, which is the swimming program, is so popular with the Asian ladies that they will be out there early in the morning to queue up, and there is not enough places for them, even with 4 swimming pools within the borough. There's still not enough available time for all these ladies to have a swim. So, I mean, that's how eager they are to join these courses and take part.
There's a huge need.
Who is paying for these activities?
It's the PCT, the Primary Care Trust. So we have a yearly amount of funding, and I get excited where that's all put. And our largest expense is exercise, so that we can provide, because that's as far as we keep staff low. It's myself and one other person, our permanent staff on the programme, and we'll look after everyone, and all the expense is exercise, so that everyone can do as much as they can.
That is very
They
preventative.
are free of payment.
Free of everything, any exercise that anyone does on the programme is free.
And initially it's a 12-week course that we're on, and we're probably into week 10. Week 10 of our course, and I think all of us have lost some sort of weight, and we've all actually noticed a difference in our health.
In controlling your own body, you know, keeping the body fit, and I think that's very important, keeping the blood pressure down, this kind of thing, it's very important. The free aspect is very important as well, because I was put off by going to the gym because it cost too much, so I never went to the gym. But now I'm going to the gym, you know, because I can, you know, because it's free and I can afford it. And I think that also increases jobs because, you know, if more people go to gyms, then, you know, then people will be needed to look after them, so we can actually begin to increase that kind of healthy living